Hey guys, welcome back to my channel, Pinoy Abroad. So today we're here in St. Paul, Minnesota at the park, currently walking. We just want to take ourselves for a walk. Also, I wanted to take the opportunity to talk to you guys about my career as a nurse, especially my career at the hospital. And I wanted to compare and contrast that to my job previously at the nursing home. So the reason why I want to talk to you guys about that is because a lot of Filipinos out there are nurses and they're aspiring to come to the States and work here, and they're looking for an institution like a hospital, a nursing home, or a home health agency. So I wanted to give you an idea of how it's like to work in a hospital versus how it's like to work in a nursing home setting or in another setting. So guys, this is my first hospital job here in the States, and I could tell right off the bat that it's been great. The reason being is that hospital gives you a lot of experience. Not all the units in the hospital can give you a lot of experience. There are certain units that give you a lot of experience, especially if you're working in a med-surg unit, working in the ICU unit, or in the ED or emergency department. And that's because it gets really intense on those units, and there's just a ton of things that you can learn from. The reason why I've chosen hospital over a nursing home setting is because there's just more to just experience. There's benefits that you can get from the hospital. Well, there's also benefits you can get from the nursing home. It's just that there's more benefits you can get at the hospital, and the pay is better, the pay is higher. At least for me, it's $10 higher per hour. And also on top of that, on top of the experience, you get to apply everything that you've learned from nursing school. So when I actually graduated from nursing school, I felt like when I started working at the nursing home, I felt like that everything that I learned from nursing home wasn't really all worth it, because I thought this was what I was doing. Because at the nursing home, all you have to do is just kind of like pass pills, assess your patient, do your dressing, and kind of just go from there, communicate with the doctor and stuff like that. So it just revolves around that, around those things. So there's really no skills. So as opposed to when you're working at the hospital, there's a lot of skills that you have to do, and there's a lot of variety of patients that you have to deal with, and every patient is different, and every day is a learning day for you, because it's not like in the nursing home guys. Pretty much all your patients are stable, and you get the same patient every day. They're stable and they're living in the nursing home, as opposed to the hospital. At the hospital, the longest a patient could stay is about 3 days, depending on the case. Sometimes a patient can stay about 3 weeks, but then that would be like a really unique situation. So every day you see different patients and different cases. At hospitals, everything that you find in your med-surg book, you'll find in the hospital, especially if you work in the med-surg unit. I'm really excited. When I applied to the hospital, I was accepted in the med-surg unit, and I started working, and there was just a ton of information that I was overwhelmed with, and which could turn out to be bad depending on the individual, but then it turns out to be good to me because I learned a lot from them. You'll deal with a lot of different patients, like patients who are septic, patients who are having hypovolemic shocks. You'll learn how to hang an IV properly, and to deal with patients with electrolyte imbalances, deal with patients with clots, with blood clots, DVT, and hang pinch medication, those high-risk medications like morphine, like potassium and heparin, stuff like that. And there's a lot of cases wherein it forces you to use all your skills as a nurse, and that's what makes a hospital job really good, because it forces you as a nurse to use up all your resources, all your knowledge, all your skills in order for you to take care of your patient. Kind of different when you're at the nursing home, because then you're just like, I feel like if I'm working in the nursing home, I could just maybe just sit around and maybe just do my thing and just chart whatever I need to chart for my patient and then communicate to the doctor, and I'll be just chill, you know. At the hospital you can't just be chill. You have to be always on the run, or you're always on alert because your patients are not stable. So that can be a bad thing for a particular individual, because some people don't want like a very busy job, but then to me it's really good because it gives me opportunity to learn more. At the hospital when I started, at least they scheduled me an education or a cohort every month, and that's like to teach you that you're basically going back to nursing. So they teach you about nursing because knowledge keeps updating. It's like you're going to a class for 2-4 hours every day, or not, once a month, until you're finished with the entire cohort, and usually it's 6 months. And on top of that, they train you, and those education thing, like the 4 hours, the 2 hours education, you're paid for that, and you get a ton of benefits, like especially healthcare insurance. It gets really expensive here when it comes to healthcare insurance, but when you work at the hospital you get a lot of discount with the healthcare insurance for your family. Right now I'm paying only less than what I used to pay for my healthcare insurance. It's crazy because my wife, she's pregnant right now, and she keeps going back and forth to the doctor's office. Like, you know, every time she sees the doctor, her blood pressure is slightly high. Doctor sends her to the lab to get checked for preeclampsia, and that happens like every time, like even like twice a week. And you know, I imagine myself, if I didn't have a good insurance, I'd be paying a ton more of money just to you know, just to take care of those bills. But then with this insurance that we have, it's really great because it covers most of it, like at least 90% of the bill. And then there's like a maximum that you have to pay in a year. It's like $1,500 or $1,500, and then once you've met that, you're not paying anything anymore, like regardless of what kind of procedure, regardless of what kind of medical procedure or care they're giving you. So that's a nice thing about hospital. And yeah, of course the pay too. The pay is really great. Like I said earlier, it's about $10 for me. It's $10 higher per hour, and that's really good, guys. It's really good. So as a piece of advice to you guys who are aspiring to come here to the States, if you're nurses, aspire to get a job, land a job at the hospital right away. It may be harder for you guys to land a job if you're newbies, if you're just freshly coming to the States, and that's because they're looking for experience. But then if you can get that job, that would be great, because that's where all you're going to learn all the experience. That's where all you're going to get all the benefits. And yeah, just aspire to get, I mean, if you can't get a job right away, start at the nursing home or somewhere else. As long as you're gaining all that experience, you can add that to your resume soon, and then finally you can submit that to the hospital, and you know, they might, who knows, they might consider your application next time. So guys, that's it. I think I'm gonna end my video here. Just a tip for you guys: aim for a hospital job, because that's where all you're gonna get the money, you're gonna get the experience and the benefits. I hope this video gave you at least an option, an idea of what it's like to work in the hospital versus how it's like to work in the nursing home. So if you do like this video, give it a thumbs up, and if you're new to my channel, subscribe and hit the bell button. Again, hit the bell button so that I can notify you on my next video. That's it, guys. I'm gonna end my video. I'll call this a day. I hope you guys have a good rest of your day. Peace out.